A varicocele is a dilated vein of the spermatic cord and is associated with infertility and may result in atrophy of the testes. This is more common on the left than on the right. A varicocelectomy is the ligation of the vein to reduce venous backflow of blood into the venous plexus of the testes and to improve spermatogenesis. A hydrocele is a benign fluid-filled sac that develops in the anterior testes that arises from trauma, infection, tumor, or as a result of peritoneal dialysis or a congenital condition. The goal of the hydrocelectomy is to remove this fluid. Orchiectomy is the surgical removal of one or both testicles. One testicle might be removed for testicle torsion, which is a twisting of a testicle. It can be very painful, requiring emergency surgery before ischemia or necrosis sets in for testicular cancer. Both are removed to control metastatic carcinomas of the prostate. Testicular implants are used for cosmetic reasons. A vasectomy is an elective male sterilization that is done by removing a portion of the vas deferens to prevent the movement of sperm through the ejaculatory ducts. This is a simple procedure that can be done in the doctor's office with local sedation. The dressings for this procedure are fluff dressings, Vaseline gauze, and a scrotal support. A vasovasostomy is the reversal of a vasectomy. It's a anastomosis of the vas deferens to return fertility to the male patient. This procedure is usually done with the microscope and takes much longer than the original vasectomy. A cystostomy is the opening into the bladder. A suprapubic cystoscopy is the insertion of a suprapubic catheter into the bladder for drainage. It's used to divert urine outside of the body and bypass the urethra. It can also eliminate the need for a long-term Foley catheter. Bladder tumors can be removed through a procedure similar to the TURP. A TURBT is a transurethral resection of the bladder tumors and is done via a cystoscope with use of a resectoscope. One difference is the distension media used for this procedure is sterile water. There are several types of vesical fistulas. They can occur between the bladder and the intestines or between the bladder and the vagina. Types of fistulas would determine how it would be repaired. A cystectomy is a total or partial removal of the bladder, often performed to treat bladder cancer. Bladder cancer is the second most common GU cancer after that of the prostate. After a cystectomy, a false bladder may be constructed using a portion of the bowel. Using the ileum as a portion of the bowel used to create a bladder is common. Urine flow is diverted to an isolated loop with one end of the loop is brought out to the abdominal wall through a stoma and urine is collected into a drainage bag.